What if I told you that the very medications keeping you healthy might be quietly sabotaging your hydration? That the pills you take every morning could be the hidden reason behind your fatigue, dizziness, and that nagging feeling that something just isn't right? Here's a shocking reality. 68-year-old Margaret had been taking her blood pressure medication religiously for 3 years. She was proud of her perfect compliance, never missing a dose. But last summer, she found herself in the emergency room, confused and weak. The diagnosis? Severe dehydration. The culprit? The very medication she trusted to keep her heart healthy. Margaret's story isn't unique. A 2023 study found that 73% of adults over 65 taking common prescription medications showed signs of chronic mild dehydration. Yet neither they nor their doctors connected the dots to their daily pills. The truth is, your medication could be quietly disrupting your body's delicate water balance. Most healthcare providers never discuss this critical side effect. Today, we're going to expose the 7 most common medications that could be leaving you dangerously dehydrated. And more importantly, what you can do to protect yourself. Before we dive into the specific medications, you need to understand why this issue becomes critical after age 50. Your body isn't the same hydration machine it was in your 30s. Several age-related changes make medication-induced dehydration particularly dangerous. First, your total body water decreases by about 10 to 15% between ages 20 and 80. This means you have less water reserve to work with when medications start pulling fluid from your system. Second, your kidneys become less efficient at conserving water. The nephrons, your kidneys' filtering units, decline in number and function as you age, making it harder to hold on to the water you do drink. Third, your thirst sensation diminishes. The hypothalamus, your brain's thirst center, becomes less sensitive to dehydration signals. You might be significantly dehydrated before you feel even mildly thirsty. Finally, many seniors take multiple medications simultaneously. This creates a compound effect where several drugs work together to drain your body's water stores, creating a perfect storm of dehydration. Medication category, Number 1. Blood pressure medications, ACE inhibitors, and ARBs. If you're taking medications like lisinopril, enalapril, losartan, or valsartan, you're not alone. These are among the most prescribed medications in adults over 50, and for good reason. They're highly effective at protecting your heart and blood vessels. But here's what your doctor might not have explained. These medications work by affecting your body's renin-angiotensin system, a complex network that controls both blood pressure and fluid balance. While they're lowering your blood pressure, they're also subtly altering how your kidneys handle water and sodium. ACE inhibitors block the production of angiotensin II, a hormone that not only constricts blood vessels, but also triggers your body to retain water. When the system is blocked, you lose more water through urination than you might expect. ARBs work similarly by blocking the receptors for angiotensin II. The dehydration risk becomes particularly dangerous during hot weather, illness, or if you're not drinking enough fluids. Robert, a 62-year-old patient, learned this the hard way during a golf tournament. Despite drinking what he thought was adequate water, the combination of his ACE inhibitor, hot weather, and physical exertion led to a dangerous drop in blood pressure and a frightening episode of near fainting. The hidden danger is that the symptoms of medication-induced dehydration can mimic other conditions. Fatigue might be dismissed as normal aging. Dizziness could be attributed to your blood pressure being too well controlled. Mild confusion might be overlooked as a senior moment. Medication category, Number 2. Diuretics, water pills. This category might seem obvious, but the reality of diuretic-induced dehydration is far more complex and dangerous than most people realize. Medications like hydrochlorothiazide, HCTZ, furosemide, Lasix, and spironolactone are designed to remove excess fluid from your body. The problem is that your body doesn't distinguish between excess water and the water you need for optimal function. These medications work by blocking sodium reabsorption in your kidneys, which forces water to follow the sodium out of your body. The result is increased urination, but also increased risk of dehydration, especially in hot weather or if you're not compensating with adequate fluid intake. Thiazide diuretics like HCTZ can cause you to lose 1 to 2 liters of fluid in the first few days of treatment. While your body eventually adjusts, many seniors never fully compensate for this ongoing fluid loss. Loop diuretics like furosemide are even more potent, capable of removing several liters of fluid in just a few hours. The most dangerous aspect of diuretic-induced dehydration is that it can be gradual and insidious. You might not notice you're becoming dehydrated until you're significantly depleted. Early signs include increased thirst, though remember, this is diminished in seniors, fatigue, and slight dizziness when standing. Advanced signs include confusion, rapid heartbeat, and decreased urination. Ironically, the opposite effect of what the medication is supposed to do. At this point, dehydration has become serious enough to affect your kidney function and overall health. Medication category number 3, diabetes medications, particularly SGLT2 inhibitors. If you're taking medications like Jardiance, Farxiga, or Invokana, you're using some of the newest and most effective diabetes treatments available. These SGLT2 inhibitors work by a brilliant mechanism. They prevent your kidneys from reabsorbing glucose, forcing excess sugar out through your urine. The challenge is that glucose doesn't leave your body alone. It takes significant amounts of water with it. This osmotic diuresis can result in substantial fluid loss, particularly in the first few weeks of treatment, or when blood sugars are poorly controlled. The dehydration risk with SGLT2 inhibitors is dose-dependent and blood sugar-dependent. The higher your blood glucose, the more glucose your kidneys excrete, and the more water you lose. This creates a particularly dangerous situation during illness, when blood sugars often spike and appetite decreases, leading to reduced fluid intake. Dr. Sarah Chen, an endocrinologist at Johns Hopkins, explains, "We see patients who don't realize that their diabetes medication is causing them to lose water equivalent to an extra 2 to 3 glasses per day. When they don't compensate by drinking more, they can become significantly dehydrated within just a few days." The signs of SGLT2-induced dehydration can be subtle at first. Patients often report feeling more tired than usual, having frequent urination, which they might attribute to better diabetes control, and sometimes experiencing mild dizziness. The danger is that these symptoms can progress to more serious complications, including kidney problems and dangerous drops in blood pressure. Medication category. Number 4, antidepressants, SSRIs, and SNRIs. This category might surprise you, but antidepressants like Prozac, Zoloft, Lexapro, Effexor, and Cymbalta can significantly affect your body's fluid balance. The mechanism is complex and involves several pathways. First, these medications can affect the production of antidiuretic hormone, ADH, also called vasopressin. This hormone is crucial for helping your kidneys retain water. When SSRI or SNRI medications interfere with ADH function, you may lose more water through urination than normal. Second, these medications can affect your thirst sensation and drinking behavior. Some patients report feeling less thirsty while on antidepressants, leading to decreased fluid intake. Others experience dry mouth as a side effect, which ironically might make them think they're well hydrated when they're actually becoming dehydrated. Special situations. When risk multiplies. Certain situations dramatically increase your risk of medication-induced dehydration. Hot weather. When temperatures rise above 80 degrees, fluid losses combine with increased sweating and decreased appetite for fluids. Emergency rooms see a spike in dehydration-related visits among seniors during heat waves. Illness. Fever, vomiting, or diarrhea can rapidly deplete your fluid reserves. If you're taking medications that affect hydration, illness can push you into dangerous territory within hours. Surgery or procedures. The stress of medical procedures, fasting, and medications create significant dehydration risk. Travel, changes in climate, routine, and activity, combined with stress, can disrupt your fluid balance. Protection strategies, your action plan. Now that you understand the risks, here's your comprehensive protection plan. Strategy 1. Know your medications. Create a list of all your medications and research their effects on hydration. Don't rely solely on the brief side effect summaries from your pharmacy. Talk to your pharmacist specifically about hydration effects. Strategy 2. Adjust your fluid intake. If you're taking medications that affect hydration, you likely need more fluid. This doesn't necessarily mean more water. It can include broths, herbal teas, and water-rich foods. Strategy 3. Time your medications and fluids strategically. Work with your doctor to minimize compound effects. For example, if you take both a diuretic and an ACE inhibitor, Spacing them apart and planning your fluid intake can reduce risk. Strategy 4. Monitor your hydration status. Learn to recognize early signs of dehydration specific to your medication regimen. Keep a simple log of your fluid intake, urination patterns, and how you feel. Strategy 5. Communicate with your healthcare team. Make hydration a regular topic of discussion with your doctor and pharmacist. Many healthcare providers don't automatically discuss this with patients, so you need to bring it up. Your medications are keeping you healthy and extending your life, but they don't have to leave you dehydrated and miserable. With knowledge and the right strategies, you can maintain both your health conditions and your hydration status. Remember, the goal isn't to stop taking necessary medications. It's to understand their effects and compensate appropriately. The next time you feel unusually tired, dizzy, or just off, consider whether your medications might be quietly affecting your hydration. Your body will thank you for paying attention to this often overlooked aspect of medication management.